This Lidocaine 5% topical patch elastic bandage combination package helps to reduce itching and pain from certain skin conditions like scrapes, minor skin irritations, and insect bites. It can also be used to relieve nerve pain after shingles. The lidocaine in this product belongs to a class of drugs known as local anesthetics, which works by causing a temporary loss of feeling in the area where you apply the patch. For best results, apply the patch to the affected area as directed by your doctor. Make sure to clean and dry the area before applying the patch. You can use this product as needed, but do not apply more than 3 patches in a 24-hour period. It is important to follow the dosage instructions provided by your doctor. The best time to take this product is when you are experiencing itching, pain, or discomfort from the specified skin conditions. When using this medication, be sure to carefully read and follow all directions on the product package. If you have any questions, it's important to consult your pharmacist. If your doctor has prescribed this medication, it's important to use it as directed. This product should only be applied to normal intact skin and not on broken or irritated skin. The dosage is based on your medical condition and response to treatment. To apply the patch, remove the protective liner and place it on the most painful area of the skin. Use the prescribed number of patches as directed by your doctor, usually once a day. Depending on the product, the patch may be left on the skin for up to 8 or 12 hours. It's important to follow the instructions carefully and not apply more than 3 patches once a day or leave the patch on for longer than the recommended time period. If a smaller patch is needed, it may be cut with scissors before the liner is removed. It's best to avoid getting the patch wet, but some brands may be able to withstand brief exposure to water, such as showering for 10 minutes. After getting the patch wet, it's important to pat dry gently. After each application, it's important to wash your hands well. It's also important to avoid getting this medication in your eyes or mucous membranes, such as the nose or mouth. If contact with the eyes does occur, it's important to wash them right away with water and protect them until normal feeling returns. If your condition does not improve or worsens, or if you think you may have a serious medical problem, it's important to seek medical help right away. Once used, the patches still contain some medication, but they should not be reused. It's important to fold the used patch with the sticky sides together and discard it out of the reach of children and pets to prevent accidental swallowing or application. If you experience redness, swelling, blisters, or changes in skin color at the site of application, these effects usually disappear within a few minutes or hours. However, if any of these effects last or get worse, it's important to tell your doctor or pharmacist promptly. If you feel irritation or a burning sensation, remove the patch and do not reapply it until the irritation is gone. Remember that your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, it's important to tell your doctor right away if you experience blurred vision, mental/mood changes, such as nervousness, confusion, drowsiness, dizziness, or an unusually slow heartbeat. In the rare case of a very serious allergic reaction, seek medical help right away if you notice any symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed above, it's best to contact your doctor or pharmacist. Remember to call your doctor for medical advice about side effects and to report any side effects to the appropriate health authority in your country. When using lidocaine, make sure to inform your doctor or pharmacist if you have any allergies to it or other local anesthetics. This product may contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. Before using this medication, it's important to talk to your doctor or pharmacist about your medical history, especially if you have liver disease or a certain blood disorder called methemoglobinemia. While wearing the patch, it's important to avoid exposing it to direct heat sources such as heating pads, electric blankets, heat lamps, saunas, hot tubs, heated waterbeds, or prolonged direct sunlight. Heat can cause more of the drug to be released into your body, which can increase the chance of experiencing side effects. If you are scheduled to have an MRI test, it's important to inform the testing personnel that you are using this patch. Some patches may contain metals that can cause serious burns during an MRI. You should ask your doctor whether you will need to remove the patch before the test and apply a new one afterward, and how to do so properly. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. This medication can pass into breast milk, so it's important to consult your doctor before breastfeeding, even though there have been no reports of harm to nursing infants. Narration: it's important to be aware of potential drug interactions when using Lidocaine 5% topical patch elastic bandage, combination package. This can affect how your medications work and may increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. This patch should not be chewed or swallowed, as it could be harmful. If someone has overdosed, remove the patch if possible. If you experience serious symptoms such as passing out or trouble breathing, call 911. Otherwise, call a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include severe drowsiness, seizures, slowed breathing, and slow/fast/irregular heartbeat. It's important to take this medication as directed and seek help if you experience any concerning symptoms. Make sure to schedule and attend all of your regular medical checkups and appointments for lab tests. This will help to monitor your progress and ensure that the medication is working effectively for you. If you use this patch on a regular schedule and forget a dose, use it as soon as you remember. If it's close to the time for your next dose, skip the missed dose and continue with your regular schedule. Do not apply double the amount to make up for the missed dose. Make sure to store the Lidocaine 5% topical patch elastic bandage, combination package at room temperature. Keep the patch sealed in its protective envelope until you are ready to use it. It's important to keep all medications away from children and pets for their safety. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Make sure to properly discard this product when it is expired or no longer needed, as outlined in the How to Use section. This will help ensure the safety of everyone in your household. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.